Obesity is one of the most pressing public health challenges of our time, affecting millions of lives across the globe. According to the World Health Organization, worldwide obesity has nearly tripled since 1975. In 2016, more than 1.9 billion adults aged 18 years and older were overweight, and of these, over 650 million were obese. These numbers are not just statistics. They represent real people, families, and communities grappling with the far-reaching consequences of a complex health issue. But what exactly causes obesity? The answer is multifaceted, rooted in a combination of genetic, environmental, behavioral, and metabolic factors. At its core, obesity results from an energy imbalance, consuming more calories than the body expends. However, this seemingly simple equation is influenced by a web of interconnected factors that go far beyond individual willpower or lifestyle choices. Let's begin with genetics. Research has shown that genetics can play a significant role in a person's susceptibility to weight gain. For example, studies of twins and families have demonstrated that the heritability of body mass index, or BMI, can range from 40% to 70%. Certain genes influence how our bodies store fat, how efficiently we burn calories, and even how hungry or full we feel. One well-known example is the FTO gene, which is associated with increased risk of obesity. People with specific variants of this gene are more likely to consume higher amounts of food and have a preference for calorie-dense options. However, genetics alone cannot explain the dramatic rise in obesity rates over the past few decades. Our genes have not changed significantly in that time, but our environment and lifestyles have. This brings us to the second major factor, the modern food environment. Over the past 50 years, there has been a dramatic increase in the availability and marketing of highly processed, energy-dense foods. Fast food, sugary beverages, and snacks high in fat, salt, and sugar are now more accessible and affordable than ever before. According to data from the United States Department of Agriculture, the average American now consumes about 17 teaspoons of added sugar per day, far exceeding the recommended limit of 6 teaspoons for women and 9 for men set by the American Heart Association. Portion sizes have also grown substantially. A study published in the American Journal of Public Health found that typical portion sizes in restaurants and packaged foods have increased by 2 to 5 times compared to the 1970s. Larger portions encourage overeating, often without people realizing it. Another significant contributor is physical inactivity. The World Health Organization estimates that more than 25% of adults and 80% of adolescents worldwide do not meet the recommended levels of physical activity. Sedentary behaviors, such as spending hours watching television, working at a desk, or using electronic devices, have become the norm in many societies. The rise of technology and urbanization has led to fewer opportunities for physical activity, both at work and during leisure time. For example, a study in the journal Obesity found that daily step counts among adults in the United States have declined by more than 1,000 steps per day over the past 2 decades. Socioeconomic factors also play a crucial role. People living in lower-income neighborhoods often have limited access to healthy foods, safe places to exercise, and healthcare resources. Food deserts, areas where affordable, nutritious food is difficult to obtain, are a reality for millions. In the United States, data from the Centers for Disease Control and Prevention show that obesity rates are highest among adults with lower levels of education and income. Psychological factors, such as stress, depression, and emotional eating, can also contribute to obesity. Chronic stress triggers the release of cortisol, a hormone that can increase appetite and promote fat storage, particularly around the abdomen. Studies have shown that people experiencing high levels of stress are more likely to crave high-calorie, comfort foods, and less likely to engage in physical activity. Certain medical conditions and medications can also lead to weight gain. Hypothyroidism, polycystic ovary syndrome, PCOS, and Cushing's syndrome are examples of conditions that can affect metabolism and body weight. Additionally, some medications used to treat depression, diabetes, and high blood pressure can cause weight gain as a side effect. Sleep is another often overlooked factor. Research published in the journal Sleep found that people who consistently get less than 7 hours of sleep per night are more likely to gain weight and develop obesity. Lack of sleep disrupts hormones that regulate hunger and satiety, leading to increased appetite and cravings for unhealthy foods. Given the complexity of obesity's causes, how can it be prevented? The good news is that there is a wealth of scientific evidence pointing to effective strategies for prevention, both at the individual and societal levels. First and foremost, a balanced diet is essential. The World Health Organization recommends limiting the intake of total fats and sugars, increasing the consumption of fruits, vegetables, legumes, whole grains, and nuts, and choosing lean sources of protein. A systematic review published in The Lancet found that people who eat at least 5 servings of fruits and vegetables per day have a significantly lower risk of obesity and related diseases. Portion control is another powerful tool. Research has shown that simply reducing portion sizes can lead to meaningful weight loss over time. In one study, participants who cut their portion sizes by 25% consumed an average of 250 fewer calories per day, resulting in a weight loss of about 1 kilogram over 4 weeks. Physical activity is equally important. The Centers for Disease Control and Prevention recommend at least 150 minutes of moderate-intensity aerobic activity, such as brisk walking, or 75 minutes of vigorous activity, such as running, per week for adults. Strength training exercises should be included at least 2 days per week. Regular physical activity not only helps burn calories, but also improves mood, boosts energy levels, and reduces the risk of chronic diseases. Reducing sedentary time is also crucial. Simple changes, such as taking the stairs instead of the elevator, standing up and stretching during long periods of sitting, or walking or biking for short trips, can make a significant difference. A study in the journal Diabetologia found that replacing just 30 minutes of sitting with light activity each day can reduce the risk of obesity and type 2 diabetes by up to 20%. Addressing psychological factors is an important aspect of prevention. Mindful eating, paying attention to hunger and fullness cues, eating slowly, and savoring each bite, has been shown to help people make healthier food choices and avoid overeating. Cognitive behavioral therapy and stress management techniques can also be effective for those who struggle with emotional eating. Sleep hygiene should not be overlooked. Establishing a regular sleep schedule, creating a restful sleep environment, and limiting screen time before bed can help ensure adequate, high-quality sleep. Research has shown that people who get enough sleep are more likely to maintain a healthy weight and make better food choices. At the community and policy level, there are several strategies that have been shown to be effective in preventing obesity. These include implementing taxes on sugary drinks, restricting the marketing of unhealthy foods to children, improving food labeling, and increasing access to healthy foods in schools and workplaces. For example, after Mexico implemented a tax on sugar-sweetened beverages in 2014, purchases of these drinks dropped by 7.6% in the first 2 years, and purchases of bottled water increased. Schools play a critical role in obesity prevention. Providing nutritious meals, incorporating physical activity into the school day, and teaching children about healthy eating can set the foundation for lifelong healthy habits. According to a report from the Institute of Medicine, school-based interventions that include changes to both the food environment and physical activity opportunities are among the most effective strategies for preventing childhood obesity. Workplaces can also promote healthy behaviors by offering wellness programs, providing healthy food options in cafeterias, and encouraging physical activity breaks. A study published in the Journal of Occupational and Environmental Medicine found that employees who participated in workplace wellness programs were more likely to lose weight and improve their overall health. Urban planning and transportation policies can make it easier for people to be physically active. Creating safe, walkable neighborhoods, building bike lanes, and improving access to parks and recreational facilities can encourage people to incorporate more movement into their daily lives. A study in the journal Preventive Medicine found that people living in neighborhoods with high walkability are 30% less likely to be obese than those in less walkable areas. It's important to recognize that preventing obesity is not just about individual choices. It requires a supportive environment and coordinated efforts from governments, communities, schools, workplaces, and families. Stigma and discrimination against people with obesity can also be barriers to prevention and treatment. Promoting a culture of respect, understanding, and support is essential for helping everyone achieve and maintain a healthy weight. In conclusion, obesity is a complex condition with many causes, including genetics, environment, behavior, and social factors. Prevention requires a comprehensive approach that combines healthy eating, regular physical activity, adequate sleep, stress management, and supportive policies and environments. By understanding the science behind obesity and implementing evidence-based strategies, we can work together to create healthier communities and improve the lives of millions of people around the world. The path to prevention is not always easy, but every step counts, and the benefits, both for individuals and society, are profound and lasting.